Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. David Rhew. As Chief Medical Officer and Head of Healthcare and Fitness for Samsung Electronics of America, Dr. David Rhew focuses on the applications of technology to improve and expand the landscape of healthcare. Thank you so much, Dr. Rhew, for joining us today. I really appreciate you spending some time with us, fresh off the stage from delivering your keynote for the Medtech Impact Conference. So what would you say was the single most important message that you tried to deliver to your constituents in the audience today?
Yeah, I think one of the things that I wanted to talk about was how consumer technologies can be used to help engage individuals in their own health. And we oftentimes think of engagement as being something that's a nice to have, but what I wanted to share was that there's a lot of data out there that shows that if you can engage individuals in their health and support them through family and friends with digital health networks, you can have some really good outcomes. And in fact, one of the studies that I showed was that through engagement on applications specific around diabetes, we could get to a reduction in what's called hemoglobin A1C by about 2%. And that's compared to, if you look at randomized controlled trials for medications, a drop of 1%. So in other words, the level of engagement is about twice as effective as improving outcomes as standard medications. And we don't think of engagement as a treatment tool, but it is highly effective, and we just need to figure out ways that some of these tools can be used to be deployed. And that's one of the key messages. I want people to walk away thinking, wow, I didn't realize that we have in front of us an opportunity to dramatically improve outcomes, and it's all around using these digital health tools.
So you were educated as a physician?
Yes.
You went to University of Michigan for your undergrad, if
That's
I'm
right.
correct. Okay, and where did you go to medical school?
I went to medical school at Northwestern in Chicago, and then from there I did my training out in the West Coast, first at UCLA and Cedars-Sinai, and did it in internal medicine. A good part of my training was spent just becoming more acclimated to how clinical practice is delivered, but I also had a very strong and sort of hidden passion around how technology could be used to improve health. So at the University of Michigan, I studied computer science. And it's funny because many of the reasons why were not because of any career aspirations. I just loved video games at the time. I wanted to program.
Truth be told. Anyone in particular? Or anything?
You name them. There are a whole series of them. And I wanted to program, and I wanted to do some cool stuff. But at the end of the day, I figured, well, that was fun. Now I've got to think about my career, and I kind of put that off to the side. But when I was able to do some of the research at UCLA and Cedars-Sinai, much of my research focused around how we could provide the right information at the right time to influence decision making, which is now today known as clinical decision support. And in order to make that scalable, we realized that many of these tools need to be automated. And so through working with colleagues, we had built a company that was owned by Cedars-Sinai. It was called Zynx Health. And this company built clinical decision support tools. And I was the individual that was responsible for putting a lot of the content and creating a lot of the solutions and making it more digital.
Were you still practicing medicine at that time?
Oh yeah, absolutely.
So you're implementing this into your own practice?
It was about 50% time clinical, 50% doing what I'll call research, which was a large part around technology implementations and figuring out how these tools could be used, and then studying it. We did what's something called health services research, which is the evaluation of how these interventions could improve health outcomes, specifically access to care, quality of care, improving the patient experience, reducing costs. And we found that we could be highly effective when we gave that information to physicians. So a really good example is we had a study where physicians were presented information that your patients have fulfilled low-risk criteria. These are both pneumonia patients, and then there were other patients like cardiac, and could potentially be transferred to a lower level of acuity and then discharged home. Well, that was new for many physicians. They hadn't really kind of seen this criteria. They were unaware that these patients could potentially be sent home. But when they saw the data, they were like, okay, well, we'll try it. And we found that by presenting that information, we actually were able to improve the ability for us to send patients home. And we followed them up for 30 days, and we found that they actually did just as well. They were happier and potentially had less complications.
So what was the epiphany that you might have had, or what have you, that made you change your trajectory entirely and move from the practitioner side over to technology full time?
Yeah, I would say it wasn't so much an epiphany. It was just over time I realized that in order for a lot of these tools to become more scalable, we had to have technology. And that has been a general theme of what we've been looking at, how technology can help us scale some of these interventions. And so what these tools that we had built were being delivered at the time in our original studies by nurses running around the hospital, not a very scalable initiative. And when the studies were completed, we actually saw returns to baseline in terms of the overall results. So if you remove the intervention, then you don't have an opportunity to have sustainable results. So the only way you can keep it sustainable and continue to update these is to have some kind of an automated decision support. And this is right around the time that the electronic health record was starting to pick up. So we started building tools that could be automated and brought into the EHR. And at that time, this company that I was a part of was acquired by Cerner, which is a large health IT company. And we very quickly became engaged in the whole process of providing clinical decision support in the setting of an electronic health record. And by the time we left, or I should say by the time I left, we had over 2,000 hospitals using our software, covered 55% of the US population, were ranked as the leading clinical decision support company in the industry. So I had a really exciting opportunity to do something that was transformative. But for me, the changing, or I guess maybe it is an epiphany, the thought that came to my mind was, so much of this is based on changing physician behavior. But as soon as a patient leaves the hospital, as soon as they leave your clinic, what control or what influence do you have in terms of their ability to make better decisions? And so what about clinical decision support, right information for the right time for patients and consumers, and how can we better support that? And in order to do that, you really need to start thinking about what's the consumer workflow, what are the technologies that they use every day, and mobile technologies is probably one of the starting points that we need to think about. People use smartphones regularly. Could you use a smartphone as a vehicle to be able to present and capture information and enable better care? And that's when I joined Samsung about 4.5 years ago, and we've been on this really exciting journey to be able to take some of these digital health tools and make them something that can be used by both patients and their healthcare providers.
And what are some of the priorities now that you're working on, either both yourself and Samsung as a whole?
Yeah, I think one of the things that we want to do is we want to create highly innovative, what we'll call disruptive technologies, innovations that will dramatically improve the lives of individuals. And to give you an idea, what we're realizing is that in many cases we have started off with some real basics, like I'll call it the crawl, walk, run phase. In the crawl phase, we've been doing telemedicine, we've been presenting data from wearables to clinicians and other care providers, and that's building a lot of the infrastructure. But what we're starting to realize is that some of these tools that we use today could be used in ways that we had never even envisioned. So a really good example is with virtual reality. So much of virtual reality has been focused on entertainment. We had been looking at a way to entertain and improve the overall patient experience in a hospital or in a waiting room. And maybe as children were about to receive a shot, or they were perhaps going to get their cast taken off, they might use VR to remove that. Or maybe do some medical training, for individuals. And that was kind of the scope of what we saw for VR. But what we hadn't realized was that there was an opportunity to use VR to actually treat medical conditions. And in fact, it's been used for many years to treat conditions like post-traumatic stress disorder, pain, stress, anxiety, neurologic conditions like stroke, spinal cord injury, visual issues. And what we've realized is that in many cases these had been validated studies done in research settings. But then over the past, I guess maybe 5 years or so, or maybe even longer, we have seen an explosion in terms of the research, the clinical research, and in large part because these devices that used to be really expensive, tethered to a machine, only in research settings, and the quality was, something that we always was something that people were concerned about, could be delivered on a mobile device that was inexpensive and accessible to a large number of people. So we saw clinical studies being done in real-world settings, in nursing homes, in hospitals, and clinics. And that's when we started seeing a lot more studies on things around how pain could be better managed. And right now, we just completed a randomized controlled trial with Cedars-Sinai and a company called Applied VR to look at how VR can reduce pain and compared to a control group. And the control group, just to give you an idea, are individuals that were watching similar content on a TV. So it really wasn't the content that was the reason that we're seeing the dramatic.
Delivery of the content.
It was, this immersive experience. And it's so interesting because when individuals have had functional MRIs done to look at what's happening neurologically or neurochemically, we can see that individuals that have pain will have high levels of activity on the functional MRIs. But when you put the VR, the pain will subside, but also the neurochemical activity will subside. So you'll see that on the functional MRI. And then here's where it gets really interesting. You take the VR headset off, and many of these individuals will have sustained pain relief for hours afterwards.
Remarkable.
And we have seen clinically individuals such as those children with sickle cell pain crisis. This is an extraordinarily painful condition, normally requiring IV narcotics, hydration, hospital admission, being given VR in the ER and being sent home. Individuals that have had surgery where they oftentimes require narcotics, IV and oral, alternating their narcotics with the VR and literally reducing their narcotic load by 50%. So really amazing stuff. A woman delivered a baby using VR, no epidural. So some real interesting and
what exactly is on the content of this?
It's typically calming, things like on a beach or swimming with the blue whales, flying over things. I really do believe it's making it easier for people to get into that meditative state. It's very hard for most individuals to get into that state, but the VR, for some reason, just makes it easy for you to kind of all of a sudden feel immersed.
That's fascinating.
It's really incredible.
So what else exciting things are Samsung working on that you have your hand on and your...
So the VR is an area where we started looking at with pain, but we also started looking at other medical conditions, and one of which was individuals that have visual disturbances or visual disorders. So macular degeneration, glaucoma, cataract. And what we realized...
The whole senior sector for the most part.
Seniors, yeah. In many cases, these are older individuals, but not necessarily. Sometimes we've seen younger individuals with these conditions. And what we realized is that if there was a technology that allowed us to be able to take that image, sort of real-time Photoshop it, and then present it to the individual, sort of like these corrective glasses that have this high-level processing, could we restore vision? And we did. And so we created this application called Relumino, which takes the imagery. So now if you imagine the VR headset's got a smartphone on it, and it's got a camera on the back, it's pulling all the imagery in, it's doing AI processing on it, and so it then displays that image so that you can see it. So like for macular degeneration, there's this big black spot in the middle. You can't see around it, so people are oftentimes looking around, can't see it. It's taking that imagery and it's like displacing it and putting it so you can see it. And there's another company we've been working closely with called Iris Vision, and they've been doing something very similar, and it's exciting work. When we did a clinical trial of individuals, I think it was around 8 individuals that had really functional blindness, 2200 vision. We presented them with this tool set. It's just really a VR headset with the software application on it. Their vision improved to 20/30. I mean, that's incredible. It's amazing. And this is something that we launched. It's a free app. We're not charging for it. It was launched by our corporate citizenship group. We really wanted to address a way, or present a way for us to give technology to individuals that really need it and allow them to be able to take full advantage of it. And what we're trying to do is we're trying to push the envelope of what's possible. It's really exciting stuff.
So what do you have coming down the pike for the practitioner in their office to utilize with their patients on a daily basis?
So some of the things that we're thinking now about are common conditions, like diabetes care, like managing cardiac care. Like how does one think about just generally speaking managing medications? And as we've been thinking about all of these, we've been building programs and building platforms and helping organizations understand how these platforms can be used. So diabetes is a really good example. What we realized is that diabetes, if you present digital coaching tools to patients, that we have an opportunity to potentially increase engagement and then also improve outcomes. I shared that with you earlier. Now, what we thought was that could we then enable this to become more consumer friendly? Because today, many of these applications need to be prescribed by doctors. If we sort of look at this from the consumer angle, could we help patients and make this an easier tool for them to use, maybe even bring in the wearables and other tools. And so we have been, and you'll be hearing more about this in collaboration with the American Diabetes Association and other groups, looking at how these tools can be deployed to, one, identify individuals who may be at risk, and then present them with tools that can be used by themselves and their clinicians to help them with their diabetes care. And it's around digital health coaching and wellness. And we're doing something very similar with patients who have had heart attacks, cardiac rehabilitation. We've been looking at ways that these digital tools can be used to improve health outcomes, but really adherence to coaching, helping them stay active, helping understand when they're needing assistance.
Do you find that you have to re-educate the physicians?
Absolutely.
That has to be a struggle.
It's a struggle, but it's also enjoyable because we're presenting them things that they also find quite fascinating, and there's strong clinical data behind it now. It's not just, hey, we've got a cool tech that could potentially work. We're backing it up with some pretty strong data that, we're talking about randomized controlled trial data, clinical experiences. We've got some leading healthcare organizations using this, and in many cases, this ends up becoming a very compelling value proposition for organizations to say that, they're seeing great results. This is something that many folks are doing. We need to better understand how we can implement it in our organization. So we're seeing really a lot of interest. I would say that the industry is not quite mature in the sense of the payment models haven't been fully aligned to support these type of tools. Really, we're talking about preventive care.
Right.
How do you prevent bad things from happening? And in many cases, the tech is moving faster than the reimbursement models. But that said, we're kind of hoping that both catch up, and at some point we're going to be able to see an alignment of both.
Do you miss practicing medicine?
I actually feel like I am practicing. It's not
your patient base is a lot larger, I guess.
Yeah, I'm working with healthcare organizations that are delivering the care, but I'm helping in terms of how we can deliver it. And it really is very fulfilling. I enjoy it. Every day I wake up, I'm excited about what's new. It's always something new. I love these conferences because it gives me an opportunity to learn from others that are doing some highly innovative things. And in many cases, we're seeing a lot of the innovation occur outside of healthcare. We'll hear about organizations that have found ways to make and improve the operational efficiency of how care is delivered, or I should say care, just how things are done. American Airlines using our wearables to help in terms of how you clean the planes and enable one to go from one row to the next and sort of document all of that. Couldn't that be used in the hospital? Absolutely. So thinking about how one can operationalize those type of things. We're talking to leading sports organizations that have been looking at these tools and saying, couldn't you use some of the VR to help some of our players get into a better state of mind and lead to better sports performance? So it's interesting because I think many of the great ideas are being done or implemented in industries outside of healthcare, and we're starting to recognize that couldn't you adopt some of those same approaches and make it relevant to the healthcare setting? And in many cases, that's where a lot of the innovations are going to come from.
As far as the medical school environment and teaching the doctors of the future how to implement this and have buy-in from day one, what do you hope and what are your expectations on their collaboration with either your organization or others like yourselves?
I would love for the medical curriculum to be able to allow young doctors and even more senior doctors to be given an opportunity to do something above and beyond the current standard practice, standard clinical. It typically falls into two categories: clinical practice or research. And within clinical, it's academics or community-based. But what about opportunities to start thinking more population health-based, using digital tools? What about opportunities to understand how digital tools can be implemented within the hospital? You know, what we've heard, some people use the term of virtualists. Could we enable doctors to become more specialized in terms of delivering virtual care? Virtual care could be everything from telemedicine to how you deliver a remote cardiac rehabilitation. And as we think about that, there aren't enough clinicians with enough experience in understanding how these can be used. I'll give you a good example. So with virtual reality, we've seen some great results. But what we also realized is that one of the biggest factors is that it's how you position it to the patient in terms of whether or not they'll use it or not. Because if you come in and you say, well, we've got this tool, it could be interesting, it could be helpful, the immediate response will be, I came in for a medical condition, you know, I don't want to be an experiment on your research. But if you come in and say, we have actually an approach that can help decrease narcotic uses potentially, has been shown to decrease pain in clinical trials, we believe this could dramatically help and improve your life. That's a very different way of positioning it. And then you describe and you know how it can be implemented and then the patient is much more eager and willing to accept that technology. So a large part of it is how you get individuals to become experts in this space so that you can understand how to educate, deploy, and continue to derive value from these technologies.
So where do you see your role in this in 5 years from now?
I would love for us as an organization, or I should say as an industry, to start finding ways that some of these technologies can be more widely adopted, more scalable. And it's going to require many things, one of which is certainly the models will need to change, but we're going to need to start seeing greater transparency of the data, making it understandable for individuals. We're going to need to see technologies become much more customized for individuals. So today we typically think of, you'll give a certain device to a patient and they either figure it out or they don't, or somebody else figures it out for them. Imagine a world where the technology actually gets adapted to meet the needs.
More personalized.
More personalized. And then looking at how we can understand how behavioral science and how to motivate people and the roles of social circles and digital sensors. So I would love to be continuing to look at some of the things that are on the leading edge, but also finding ways that allow us to be able to think about how we scale this and how we can implement it. Because scalability will probably be the next big challenge apart from the reimbursement models, because we are in a world where there's a lot of pilots and there's a lot of great ideas, but what we want to do is we want to figure out how this is something that can be used by many people, and that's going to require us to sort of rethink in terms of how we take some of these great ideas and build this into a model that is highly scalable.
And what is your role in that on a daily basis?
So today I really spend a large part of my time helping to define the path forward, helping build the partnerships and kind of define how we can, we'll call it go to market in terms of some of the commercialization elements. And again, this is something that I really enjoy, and I think that this will continue to be an important part of what we do at Samsung. But at the same time, there will be some new innovations that come out, and some of it will be from Samsung, some will be outside, and I want to see if there's ways that we can continue to push the envelope of what's possible. So I'll give you one example on that. Virtual reality to treat spinal cord injury. Wow. This is something, this was a clinical trial that was done, 8 individuals who had complete paralysis, upper and lower extremity, loss of bowel and bladder, and some for as short as 3 years, some as long as 13 years. And what they did is they all went under a program, a 1-year program, in which virtual reality was used to treat these individuals in conjunction with an exoskeleton, which sort of kind of helps them move. And so this program, after 1 year, all the individuals actually regained some function, and half of them were upgraded from complete paralysis to partial. In fact, there's a great YouTube video that shows one of the individuals taking some steps. I think this was at the World Cup in Brazil. just incredibly powerful. We've one of the individuals that also, another individual that improved their function was one who had been paralyzed for 12 years. Imagine being paralyzed for 12 years, not having any function of your bowel and bladder, and then with this technology, you're able to regain some of that function. I mean, it brings not only an improved quality of life, it brings dignity, it helps in terms of the resources that are required to manage, improves the quality of life for the family around them. I mean, benefits all around. And people have asked me, like, how could that possibly be? And you have to kind of understand that when individuals have spinal cord injury, we're not talking about severing of the spinal cord, we're just talking about injury. What typically happens is that there is a roadblock in the neural pathways from the brain to the extremities, and similarly from the extremities back up to the brain. And when the major highways are damaged, and that's all you've ever used, typically traffic stops. But now imagine someone showed you the path, a side road, on how to get there, go up and down, and you travel that path consistently, where it soon becomes almost secondhand, and you're building that knowledge, that neural knowledge, and that is enabling us to sort of rebuild these neural pathways. And that's what people had not envisioned could happen when you've had such a long period elapse. But we are realizing that we can now do that. It's almost in some ways tricking your brain to think that you are doing something, and then having the brain, the motor sort of show it, and then eventually these connections occur. And those are things that excite me. I can't wait to see what's next.
Well, I can't wait to see what's next either, because it really sounds incredibly remarkable and fascinating, and just the good that you're going to do for so many with so many disabilities and illnesses and disease and whatnot. So it's wonderful to have that to look forward to on both from the consumer side, patient side, et cetera. So one thing that comes to mind when thinking about the future of medicine and implementing all of these incredible technologies that you were speaking of is the idea and the concern of privacy and, you know, consumer information out there and patient information out there and HIPAA, et cetera. Can you expand on what you're doing as a company and organization to protect the information?
Yeah, great question. And I think this is an area where we've spent a lot of time thinking about the data at rest and the data in transit. And typically when you think about healthcare applications, most of the people have thought that this is just my own data, it doesn't really matter. But now it's starting to be used by healthcare providers to manage one's care. It's becoming part of the medical record. It needs to be secure. There's issues around HIPAA, there's issues around potential hacking into that. And as organizations start thinking about this, it really starts falling into the general category of how can the devices that are capturing the data capture it in a secure manner and then enable that this not to get sort of hacked into. 84% of cyber attacks occur at the application layer. So it's interesting, you may not even realize that your data has been compromised, but it could be being sent into two different places. So you're sending it to your doctor, but you're also sending it to, you know, an unsavory character that's doing something with it. And what we have realized is that in order to actually protect this, it's hard when you ask individuals to just simply be careful, because no one can be perfect and there's always something that occurs, is you have to build in a layer of protection on the device that starts at the hardware level and goes to the software. And so that's what we did. We spent a large amount of our time thinking about what could that platform look like. And we built something called Knox, sort of like Fort Knox, K-N-O-X. And we started off in the government space because that was an area where they absolutely needed to make sure that the data, if they're out there, you know, sending messages and they're storing things on their device, it needs to be locked down. And what we wanted to do is we wanted to make sure that that
Which
data...
administration was utilizing that?
This actually started before the
Okay.
current one and has continued throughout. So we've had a lot of experience in that space. And then we moved to the regulated, I should say, the financial industry. And in fact, a couple years ago, the CIO at Goldman Sachs went on stage with us at CTS, or I guess now known as CTA, CES, now CTA. And he talked about how they're standardizing on Samsung Knox, in large part because of the security. Gartner, which does all these evaluations, has rated the Samsung Knox platform as the most secure enterprise platform. And we're starting to recognize that this has perfect relevance for healthcare as well, especially as we start going outside of the hospital to areas where patient-generated data are now becoming areas where we need to capture and secure. And so for us, data security, ensuring data is secure both at rest and at transit has always been a high priority, and it's become something where we've now been thinking about how this platform can be used above enterprise uses, but really for patients as well as those that are managing data outside of the hospital.
One last question. So is this science that Samsung is actually developing, or are these companies or technologies that they are acquiring?
A little of both. I would say we absolutely learn from our partners out there, and we have been spending a large amount of time thinking about how we need to adapt our technologies. So a good example would be many folks have been looking at the use of smartwatches for personal emergency response system, the SOS type of thing. And the thought was, couldn't you just download an app or just have it functionality? And today, there is functionality on the smartwatch where you can push a button and you can send a message out to different individuals and notify. It sends a GPS warning, and you can make phone calls off of it. But when we delve deeper into really understanding the level that's required for this, we realized that you had to do a few other things that were not originally envisioned. And one of which is, when an individual is in danger or when they're in trouble, they oftentimes don't have an ability to respond. So let's say you fell, or let's say you were involved into a car accident and you smashed in your car and the airbag goes out, and then the OnStar is calling. And you have to, in order to access it, you have to push the button to accept the call. But you can't because you're trapped.
Right.
You need something called auto connect. It needs to automatically come through. Now it sounds simple. It's a major issue.
Where's Siri when you need her?
That's right. Is voice activation the right way, or is it? So thinking about how you can auto connect in situations of emergency, it doesn't matter. You don't want the individual they could be unconscious. You want them to automatically to kind of set the call through. If you need to push an urgent update, because these are healthcare safety issues, you can't expect the individual to download the app, the upgrade. You have to automatically push that out. That means you have to make your devices, mobile device management, ready. And when we started thinking about that and thinking about the level of requirements that we had to do on our end to reconfigure these devices to enable mobile device management, to enable secure data collection and transmission, to enable our ability to do this auto answer, then we realized that we had to kind of step it up as well. We can't just provide the device and expect these services to be delivered. And that's why this is really a partnership. We go out there, we learn what's required, we figure out how we can help, and then we reconfigure our devices. One of the topics I shared earlier was around how can technology be used by seniors? If you look at the senior population today, over the age of 85, about 20% of individuals can readily adopt a smartphone or a tablet, but about 80% will not. And so there's a general belief that 80% will typically not be able to do it. And so you need a care provider, you need someone to do it for them, which is not a scalable process. So what we realized when we delved deeper, I should say researchers, when they delved deeper, specifically at a company called Breezy, they found that there's 43 configurations that need to occur to make these tablets easier to use.
User-friendly for them.
User-friendly,
Right.
But it's not just simply make the icons bigger, but it was stuff like
The touch.
when you push off, a lot of times they accidentally knocked the icon off the side. They made it too dim. The volume they couldn't adjust. It was too loud or too soft. They couldn't remember the username password. They couldn't remember which app went to which. All of these things that seemed so basic were barriers. And so what they did is they said, okay, there's 43 configurations, let's hard code them in. It's actually, they ran a script using our platform called Knox, and they pre-configured these devices so that literally in a matter of seconds over the Wi-Fi, they could configure these devices that were standard tablets into configured devices, which are called Breezy tablets. They tested it in a group of 225 seniors.
The same age group, over 80?
A good number of them.
Okay.
There were some that were younger in this group, but these folks had never used technology before. So this is a group that had zero tech experience. And in many cases, they kind of had an aversion to tech. And what they realized is that when you did this configuration, you gave the training, and you had a program which was implemented by the National Coalition on Aging to encourage people to socialize and to stay active. After 3 months, they saw an adoption rate go from 0% to well over 80%. And they also saw a better understanding of how to use tech, but most importantly, they saw better health outcomes. They saw higher levels of social connectedness. They saw greater physical activity because people were kind of talking to each other. And it's funny because we think of tech as when you give people technology, that the first thing is that they're going to be more socially isolated and they're going to be less physically active. But for folks who are already socially isolated and are not physically active, you see the exact opposite effect. And that was so remarkable. And now we realize that now we have a platform to engage these individuals. So some of these folks were using the device like over 12 hours a day.
Oh my goodness.
It was, I mean, now we're getting to the point where they're becoming a little too addicted, but now we can use that as a mechanism.
And their grandchildren think it's really cool.
It's really cool. And so we're connecting to their smart home.
That's
so now they have an ability, they push a button, turns off all the lights.
Wow.
When they go to bed, it sends a signal to everyone else. It turns the night light on, or all these elements, and we're making the home safer for them and hoping that we can now help seniors live independently. So there's a lot of really good things, but it starts with understanding how the individual engages with technology, and it's not just about presenting a nice device with them. You really need to do some configurations to make it a little more personalized.
Wow, exciting stuff. Thank you so much, Dr. Rhew.
Oh, it's my
I look forward
pleasure.
to seeing what's coming out.
Okay, thank you very much.